people in Sydney and quite possibly Melbourne will be travelling to Bali by Christmas, but no one in WA will.
They'll be able, in New South Wales, be able to travel overseas and return.
I'd love it if they could fly into Brisbane for Christmas.
So much for Team Australia. Just as we seem to be at a pivot point on COVID infection and vaccination rates, we also seem to be at a pivot point in the politics of a pandemic. For the past 2 days, the Prime Minister has been trying to turn the politics of lockdowns, of closed borders, against the governments of 2 states in particular, Queensland and Western Australia, just as he had earlier done in attacking Victoria's pandemic management. But the pressure now is particularly intense on the Palaszczuk government in Queensland, a state where Scott Morrison definitely needs to hold seats at a federal election, and where the Premier's popularity and her stand on keeping Queenslanders free and safe has been immensely popular.
The Queensland Premier has delivered you an ultimatum last Friday: spend more on hospitals or they just won't open up.
Well, she's got to take that up with the Queensland people then. I mean, to go down this point and say, well, you know, I'm going to hold the federal government to ransom and to seek to extort from them money on the basis of COVID.
So now we have talk of the federal government being held to ransom and of Queensland seeking to extort money on the basis of COVID. The claim is based on these comments from the Queensland Premier on Friday, who said that to combat COVID, the state needed to lift vaccination rates and hospital capacity.
I'm not going to put Queenslanders at risk until both of those issues are sorted out.
However, as 7:30 reported last night, on Thursday, the day before the Queensland press conference, the health ministers of all the states and territories, Labor and Liberal, had written to Federal Minister Greg Hunt and asked the Commonwealth to extend the agreement made last year to share the cost of managing COVID on a 50-50 basis until at least the middle of 2023.
We've had a funding guarantee under COVID until the 30th of June. That has now stopped. That needs to be reinstated.
Health Minister Greg Hunt was seeing things very differently.
We've increased funding by 99%. They've increased funding by 55%. It's 50-50 for COVID-related measures. And I think we have to watch for whenever somebody gets in trouble, suddenly they ask for more money or complain.
So, every health minister in the country believes the special 50-50 deal done last year to cover COVID health costs expired in June. The Federal Minister begs to differ, and the Prime Minister is escalating the pressure on recalcitrant states, trying to pick the shifting mood of communities getting weary of lockdowns and state border restrictions.
Prime Minister Scott Morrison joins me on the line.
I want people to have their lives back. That's what I want. And that's what the national plan is designed to achieve. That's the deal. And I'm going to keep my side of the deal with Australians on this.
Except the terms of the national plan seem to have changed since the PM outlined it in July.
States and territories move into the next phase when, 1, the national average for the vaccination program as a percentage of eligible adults is achieved nationally, and then that state itself has achieved the vaccination threshold in their own state. So it's like a two-key process.
His announcement last week that international borders would open in states reaching 80% vaccination rates smashes that agreement that borders would not even start to come down until the whole country reached 80%. Now he is in a hurry. He isn't waiting. He's piling on the pressure, and the politics have become about pitting states against each other.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.